I'm Dr. Forbes. I'm a small animal veterinarian, and we need to talk about avian influenza. This is not a fun topic, and it is not uplifting. It needs to be discussed, though. So if you can please spend a few minutes just listening to this and maybe sharing the video, I would really appreciate it. There's already been a lot of good information out on social media about some of the more recent developments. There's a new genotype that was discovered in dairy cows in Nevada. That particular genotype was also associated with the one documented human fatality in the United States. There was also information published by the CDC, but very quickly deleted, that there is significant concern about the transmission of avian influenza from cats to humans. The state of New York has also suspended their wild bird markets for the moment, and there has been instruction in the human medical world to further test positive influenza A tests to identify if it is H5N1. So there's clearly some concern about it circulating among humans. Where I'm concerned is with animals, because this is what I do. So I'd like to talk to you about how we can keep our pets safe and therefore yourselves safe. I just need to take a moment to explain that even though I primarily focus on cats and dogs now in my career, I did have the privilege of working on wildlife for 4 years when I was at the University of Illinois. And it breaks my heart to think about the casualties that this virus is causing in our wild animal population. I hope we can recover from it. When I was at the wildlife clinic, I cared for all of the birds who were succumbing to West Nile virus. I just can't imagine what it looks like right now with avian influenza. If you have cats and dogs, this is what you need to know. First, cats. This disease has a very high mortality rate, 67%. Cats also become neurologic. The virus has an affinity for the brain in cats, so it is going to look just as much or more so like a neurologic disease than a respiratory disease. Unfortunately, signs and symptoms of avian influenza look like every other illness in a cat. Lethargy, inappetence, vomiting, some upper respiratory signs, lower respiratory signs, so nasal discharge, ocular discharge, coughing, sneezing, and then the neurologic signs, walking like they're drunk, having seizures, things going on with the eyes, anything that looks abnormal in that way. If you're a pet parent, you know that looks like everything else when a cat is sick. How can you prevent this in your cats? Please, if you can keep your cats indoors in any way, that is going to be the most important thing you can do. Also, this is not a time to feed raw food. Do not feed raw right now, please. I know there are so many people out there who are just so passionate about raw nutrition. This is not the time to mess around. And if you are talking to companies who make food and they're telling you that their HPP process is fine or their mild cooking processes are fine, please do not take it at face value. The food needs to be cooked to an internal temperature of 165 degrees. So if you are going to continue to feed foods that might not be the traditional, like we are cooked and it is clear that it is cooked, please do your own investigation to identify if those foods are in fact safe. That includes all meats, not just poultry, all meats, eggs, and milk. Everything needs to be pasteurized and or cooked. If you are bringing new cats into your household and you don't know their history or they have respiratory signs, I would encourage you to keep those cats separate from your other pets until their symptoms have resolved. This is not new to avian influenza. I would always recommend this. If you have a dog, going outside is obviously necessary. Please avoid areas where there are birds, especially by areas of water. Definitely avoid bird droppings. So bird flu spreads through bird droppings as well, even old, dried out, crusty bird droppings. So we need to avoid those areas. I also have had several patients who recently the clients call, oh my gosh, I opened the back door and now my dog is eating a bird. So I would also encourage you to go out into the yard if you have a large yard and just survey the land before you let the dogs loose to make sure you don't identify any dead birds. If at this point, if there is a dead bird, I would first and foremost be concerned about avian influenza. Please avoid contact with wild birds. If you have a dog who hunts with you and is a bird dog, I would strongly consider curtailing those behaviors for the moment, if possible, to avoid exposure. Dogs do seem to be less symptomatic than cats, but they absolutely do get the disease, and there have been fatalities. If your dog goes outside and you are really concerned about their paws, you can use something like this spray to clean their paws off when they come inside. Also for your dogs, no raw food, no raw meat, no raw eggs, no raw milk. Note, I forgot about the cats going outside. Catios also, do not use catios right now. Bird droppings can go into the catios and that would be considered exposure. For the 13% of Americans at a rate of about 85 million chickens spread out amongst about 139,000 households. For those of you who have chickens, backyard flocks, please learn about biosecurity measures. Here are the steps that the federal government recommends you take in order to keep your chicken safe and yourself safe. This is a time to seriously practice biosecurity measures. That means wearing different clothing in your chicken coop, wearing boots that can be disinfected, sprayed and disinfected, goggles, a respirator, gloves, and taking off all those clothes. If you have people coming over, they should not be going in and out of your chicken coop. And if you do need someone helping, they should be wearing separate clothing for your chicken coop only. I know this sounds crazy. I am not fear-mongering. This is what needs to be done at this point to keep animals safe. In the state of Michigan, if you identify a wild sick animal, here are the numbers you need to contact to help with disposal. If you do not have appropriate PPE, personal protective equipment, please do not handle sick or dead wildlife. Call for assistance. As always, if you have questions, please let me know. I'm sorry it's taken me a while to get to this. I really have big emotions about this right now. It's really hard for me to see so many animals suffering.